Hello, and welcome to UOA On Demand. My name's William Baione. I'm an orthopedic surgeon here at University Orthopaedics. I specialize in adult reconstruction, joint replacement of the hip and knee. I have the pleasure today of being joined by my fellow joint replacement partners who are specialists in this field, Dr. Kayiaros and Dr. Andrzej Brzezinski. So good evening, gentlemen. Today, we're going to talk about an interesting topic. I think it highlights a lot of the advances that we've made within orthopedics. And so we're going to focus on the concept of same-day joint replacement or outpatient surgery. So to kind of lead the discussion or kind of give us a flavor, Dr. Kayiaros, could you give us, or at least the patients or the people listening, a sense of what joint replacement used to be like, or what the perioperative process was before we got to a same-day joint replacement?
Sure, of course. So, when joint replacement first was invented, I think, patients used to stay in the hospital 2 weeks and then go to a rehab for like another 4 weeks and then eventually would go home. And over the years and decades, those time frames have progressively gotten shorter and shorter and shorter. So when I was a resident, which was a little over 10 years ago, patients would routinely stay in the hospital for 2, 3 nights, and a significant proportion of those patients would go to rehab versus home. During the latter part of my residency training, I was fortunate enough to train under someone who adopted the anterior approach for hips, and those patients were going home the day after surgery or sometimes 2 days after surgery. And then when I was a fellow, patients were routinely staying in the hospital 2, 3 nights, and mostly going home, but still a good percentage of patients were going to rehabilitation facilities. And then, as I joined, when I started my practice, there has been this shift in joint replacement surgery to outpatient or same-day surgery. And so, that can mean a number of different things to many different people. But for me, a same-day surgery means a joint replacement surgery that is being performed at a ambulatory surgery facility or a hospital, and the patient goes home the same day, so no overnight stay. And I think, the reason why that is a reality now is because the surgery has really evolved through minimally invasive techniques, anesthetic protocols, multimodal pain protocols, where we're streamlining the rehab for patients. And so patients who are motivated to go home the same day, that is a reality, and we're doing it, and we're doing it more frequently.
That was a great overview of the process. And, I had a similar experience in my training where, you saw how long people used to stay. And then as these techniques, and I don't think it's any one thing, I think we've gotten a little better at doing the surgeries, the minimally invasive approaches, how we deal with pain. There was a point where, it was like only narcotics, like someone had a pain pump, and then they were taking pills, where our understanding of the mechanisms of pain and attacking pain from different approaches using different types of medications and blocks, I think that coupled with the minimally invasive techniques has really pushed the envelope here. So Dr. Brzezinski, when you're evaluating a patient and you're trying to decide like what type of surgery you're going to offer them, whether they're inpatient or outpatient, what are some of the things that you may consider that would make someone a good patient or an ideal patient to have a same-day surgery?
Yeah, so there's a couple things I would consider decide between one-day surgery versus stay overnight. And first thing is the patient selections. So not every patient is the same. Some patients are pretty healthy, mobile, they have arthritic changes in the joints that cause a lot of pain, dysfunction. They cannot functioning like what they would like, but they otherwise healthy. Other group of the patients, there are patients that have multiple medical comorbidities. They have medical problems, medical issues, and these groups of the patients are not the same. If I consider same-day surgery, I would prefer to do the surgery on someone who has less medical comorbidities, less risk of complications related to the surgery itself, patients who can understand the idea of early rehabilitations, idea of uh, 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 be mobile immediately after surgery. The patients who have good support at home, the patients who have someone who can help in the critical situations, and other things that helps us to differentiate between the same-day surgery versus staying overnight is the team that we have in the surgical center. Most of the surgical centers have specialized teams specialized in the particular type of the surgery. So the surgery is performed very efficient with minimal invasive technique, with minimal blood loss. We have to remember that the bleeding to the joint after surgery creates a lot of pain and problems. We can offer the patients multimodal pain control with multiple medicine, we decrease the number of narcotics, and we can offer the patients early physical therapy. We have like physical therapists who can work with the patients immediately after the surgery. In these situations, the patients can safely go through the surgery, through the rehabilitation process. He can stay at home. These patients have higher satisfaction rate. They feel more normal after surgery and they recovering faster. For the patients who has multiple medical problems, who has uncontrolled diabetes, who has cardiac problem that needs to be monitoring overnight or requires cardiology consultations for these patients, I would still consider leaving the patients in the hospital for the night for the patient's safety.
That's an excellent overview, because that's something that we have to assess when we evaluate patients. I always joke with patients that, I can do the surgery like in a box van on the side of the road. So like doing the operation is one thing, but the thing that really gets the patient through the process at home is really the team. And one of the things that people don't often realize is that the ability to get to a same-day surgery is not just going through the operation, but it starts from like the moment you meet the patient. You almost have to make them believe that it's possible. And once they believe it, you have to support them through the process. So, Dr. Kayiaros, what are some of the things that you do before the operation to make patients comfortable or prepared to proceed with the same-day surgery? And I know you have a lot of experience with this with our own surgery center. And so what type of experience do you offer to a patient when you're trying to convince them that it's safe and efficient to have surgery at our surgery center?
Yeah, it's a very good question. One of the things I tell patients is that, I have the same equipment and staff, or I should say properly trained staff at the surgery center that I do at the hospital. So it's the same operation, whether it's done at the surgery center or the hospital. That's number one. Number two, I have the same bullpen of anesthesiologists that I work with at the surgery center that I do at the hospital. So it's the same operation, it's the same protocol, it's a different environment. And so the appeal of the surgery center is that you can have a joint replacement surgery, have it done the way that I've been doing it for my entire career, except that you have it done in a different environment where you go home the same day and you are able to recover in the comfort of your own home. A nurse will usually visit the patient on the evening of surgery, and then a therapist will come out the day after. And the home therapy usually will last for about 2 weeks, sometimes three, depending on patient recovery and mobility, until patients can safely transition to outpatient therapy. There was a time when arthroscopic knee surgery was only performed in the hospital setting. And obviously, it's almost unheard of doing arthroscopic knee surgery in a hospital setting. And I think joint replacement surgery was once thought to only be an operation that can only occur in a hospital. I mean, that paradigm has really shifted. And I think one of the reasons why, I should say, one of the catalysts for that was COVID. When everything shut down, and hospitals were inundated with very sick patients, that was the catalyst to say, we've been doing this surgery for so long, and we've perfected the techniques, and we were able to minimize narcotic use nerve blocks for knee replacements. There's no reason why that we can't do this in an outpatient setting.
Yeah, that's great. And there's often, when you operate in a surgical center where the physicians and the ones providing the care have some control, we can often give a better experience. And there are certain things that, as a surgeon, when you work at a hospital, that are out of your control, because it's not just orthopedics. There are a lot of things happening in the operating room. And so your ability to really create a comfortable, natural experience that allows someone to get through this operation, which can be scary for them, and to allow them to recover in the comfort of their own home and avoid some of the things that happen at the hospital, I think is attractive to many patients. In terms of, not to like be a Debbie Downer or say something negative here, but what are some of the things that, patients want to know? Well, what happens if something goes wrong? Or is there a situation where, I may need to go to a hospital, or if I'm not ready to go home? Like, what do you counsel patients about to kind of make them feel at ease in those very rare instances where they might need additional care if they're at a surgery center?
That's a good question. So to what Dr. Brzezinski said earlier, I think it starts with patient selection. And so I think it is critical to identify who is going to be a good candidate and who is going to be a patient that is safer to do at the hospital. So I think that that's the first step. The second step is making sure that patients are optimized prior to surgery. And so we always get medical and oftentimes cardiac clearance on patients prior to surgery to make sure that they're medically fit to not only undergo surgery, but go home on the same day. Aside from that, I think those are probably the two most important things that are critical. Even with that, anything can happen. Unexpected things can happen after surgery. And if something comes up, it's usually a medical issue. Then we have to assess that patient in the recovery room and make a determination of whether we have to send them to the hospital for an evaluation. Fortunately, those instances are rare.
Yeah. And Dr. Brzezinski, are there any cases that you think, in terms of, we talked a little bit earlier about revisions, like, do you see a role for doing some of these more complicated surgeries like a revision in a surgery center? Or do you consider that more of a hospital case?
I would consider them more like a hospital case, because for these cases, you have to have plan A, B, and C you can never say that forearm planning will be executed in the operating room, and that requires a lot of instruments, equipment that needs to be available in the case we change the plan. Most of the revision surgery can be planned and can be performed in any facility. However, the risk of complications related to the revision surgery is higher, and in these situations, I would prefer to do it in the hospital.
Yeah, that's exactly how I counsel patients, because that's a question that comes up sometimes. Patients want to know, and yeah, we do specialize in these very minimally invasive techniques, but when you're tackling these bigger operations, you have to look at the whole picture, and we still might be able to do them very efficiently and minimal blood loss, but revision surgery versus primary surgery, each has its own unique risk factors.
I do think that that's going to be a hot topic, though, in the next 5 years. There's been some papers coming out of some centers looking at revision surgery in an outpatient setting. Again, I think it's going to be a hot topic, and certainly open for debate. So it's going to be interesting to see how things continue to evolve in the outpatient space.
So I think that was a great discussion, to give patients an outlook on the history of joint replacement, specifically how we've transitioned from the hospital to the outpatient setting. I'd like to thank my colleagues for joining me today to discuss this topic. If any prospective patients are out there have any musculoskeletal complaints, joint replacement issues, would like to be evaluated or seek an opinion from one of our specialists, we'll direct you to our website at uoanj.com. Thank you very much for your attention, and we look forward to seeing you.